Welcome back. We're joined now by Dr. Jennifer Horney from the Texas A&M Health Science Center. She's here to let you know why somebody in town may be knocking on your door coming up here in a couple of weeks. Dr. Horney, what is this survey that the Health Science Center is conducting?
So we're going to be looking at risk factors for neglected tropical diseases in the community. So these are diseases that we didn't typically see except in people who had traveled to areas where they were endemic, but we're now seeing local cases of diseases like leishmaniasis, Chagas disease, and dengue fever in places like Dallas and Waco. So we're interested in finding out if we have the risk factors for these diseases here in Bryan College Station. Interesting.
So if somebody does knock on your door and say, hey, I'm here for the Health Science Center survey, what can folks expect?
So it's about a 30-question survey. We'll ask them things about their travel history, if they've had folks who from overseas staying with them, and we'll also ask them about other types of risk factors. So the vector for dengue is actually the same as Zika. So we're looking for those same kinds of things, buckets and flower pots and standing water. So we also have an education purpose in this to let people know what they can do to protect themselves from these diseases, specifically and other related types of diseases.
Absolutely, and these are some scary diseases that we don't want here, and we certainly don't want spreading if they do end up here. Okay, and what you've touched on it a little bit, but what really are the benefits of having more information? Why is that so important to the Health Science Center in combating this locally?
Yeah, so we've actually partnered with the local health department in Brazos County as well as the Region 7 health department in Temple. So we'll have some of their staff with us, and we'll actually use this as an opportunity to hand out materials to them to help them know about protecting themselves from these diseases, control measures that they can take to make their homes safer, things to avoid. So we think about 8 to 10% of stray dogs in Texas have Chagas. So we want to, just remind people, we don't want to be having contact with stray dogs in your neighborhood. If you see one, call and get it taken care of.
Right, don't touch it. Okay, so that is happening. This survey is happening December 2nd and 3rd. That's when you may have somebody knock on your door and ask you a few questions. And Dr. Horney is here to say, please answer those questions because it is so hugely helpful for research
purposes.
That's
right, and they'll all be wearing their EpiAssist t-shirts from the Health Science Center School of Public Health.
And that's how you'll know they're official and not just trying to ask you some questions. Dr. Horney, thank you so much
for
coming out today and letting us know what's going on.
Thank you.